Hi, my name's Jennifer, and I am going to start a YouTube channel to discuss my adventures in travel nursing, but also my journey for bariatric surgery. I am an ER nurse. I've been an ER nurse since 2006, and I have traveled since 2006. I have been overweight my whole life, and I'm ready to change that. I have looked into several bariatric programs, and I have decided upon the Gastric Bypass through Dr. Miles in Wilmington. I will take you on my journey. I know that there's plenty of nurses who are overweight and struggling with a decision on what to do. The problem is, as an ER nurse, is that I see a lot of the downsides of bariatric surgery in terms of the non-compliance and the negative side effects, or the dumping syndromes, etc. So I want to help educate, and I want to show people the right way to do it and not end up in the emergency department. That's my goal. So you'll be my witness to that. Also, I am a traveling nurse, so I will bring you with me on my traveling adventures through this year and through my RV. I just got an RV last month, and I started a remodel of it. So I will I'll post some pictures here on my channel of what it used to look like, and then the remodel when it's finished. But that's not what this channel was really supposed to be about. It is supposed to be about travel nursing. I will answer any questions you have. I mean, I've traveled for 12 years, so pretty much if you have the question, I've already had it. I do not know where my next contract is going to be so far, but I am in North Carolina currently, and I'm hoping to stay kind of within a few hours of my surgeon just for a few months after the surgery. And then I will talk to you about the decisions there when it comes down to it. I will take you with me to my doctor's appointment on Thursday if you can. And my gallbladder ultrasound is Wednesday. So let me start by saying I am 43 years old, and I am 270 pounds. I think the recorded weight that Dr. Miles had was 265 pounds. That's big. My friends don't think so. My friends hate that I want to have this surgery. A lot of them do. So they don't understand what I've gone through in 20 years of diets. Some have had friends who have died from complications from bariatric surgery. But most of those people, it was a non-compliance issue, not taking their vitamins or not staying hydrated, etc. So I'm not going to say it can't happen. I'm not going to say that I'm not going to have a bad outcome. I can just hope that if I do what I'm told to do, that it can work out okay. What else? Okay, 265 pounds. I was required to see a nutritionist twice, and what they did was they went over with me some high protein, low fat, low sugar foods. They had me go on that kind of a diet, and I have lost over 10 pounds just by following that diet. But that was only 10 pounds. You see, it's harder to lose this weight when you're in your 40s and you've tried everything. It's hard and it's frustrating, and So hopefully if you're watching this video, I bet you understand the struggle. So I did the nutritionist appointment, and then the second appointment was not about the diet, but about post-surgery, what to expect to eat on day 1, what to expect to eat on day 3, what to expect to eat on week 2, etc. And you will live that with me. I have a plan. I have a list made out of things to buy on what day, so that hopefully I can have a successful journey and not get frustrated. I did have a problem with my current employer not wanting me to take time off for the surgery. So I will probably be having it the week in between contracts. And that is a problem, because then I'm not getting paid for that week. But I've waited for this surgery for years, so I think I can take off a week if I have to. What else? Nutrition. Okay, sleep apnea. I don't know that I have sleep apnea. I don't snore. According to people that I have spent time with, I don't snore. So I thought possibly I don't have sleep apnea, but I don't really know. So they send you a sleep test, or they send you to a sleep center. My doctor just had them mail me one. I slept with this little cord around my chest and a pulse ox on my finger and a cannula in my nose. And I slept like that for a few hours and then sent it back to the company this morning. I won't know my results for some time. In 2 days, I will have my gallbladder ultrasound. They need to make sure that my gallbladder is healthy. If it's not healthy, they'll take it out on the day of surgery. So I think that's kind of what I've been reading. I have never had any symptoms of a gallbladder problem, but that doesn't mean anything. So we'll see what my ultrasound shows on Wednesday. And then Thursday afternoon, I meet with Dr. Miles himself. And then hopefully we'll have a plan for action and a surgical date. That's what I really want, is a surgical date, so I can make plans. So I am excited, and I'm excited to share the journey with you. If you have any questions, or you would like to know some certain piece of this, let me know. I am an ER nurse, so I'm quite active, pushing and pulling and CPR, etc. So we're gonna see how I can do this along with the job, and I think some people have questions about that. So you'll see my journey. And if you've watched this far, please subscribe, hit the like button, and I will keep making videos. Ask any questions in the comments. If I don't get back to you right away, I will list an email on here, so you can email me as well if you want something a little more personal. But I'm glad to have you with me on my journey. Have a great day.